It's nice to hear kind words. Eric has worked with me and Lisa and Dave over the last few semesters trying to get me up to speed in online education. So I'll let you know how close I am. So I'm over at the University School of Nursing, a couple streets over. I'm an associate professor and I oversee the psychiatric mental health nurse practitioner program. And I also have other appointments in research in pediatrics. My background is that I've been here a while. It says good clinician there because it should also say good student. I think my being a good student at the university was the reason I was invited to be faculty at the university. But in places other than education, in health sciences, for example, you get to be a teacher if you're good at your job, which sometimes works out really well, but we don't come at it with the same foundation of teaching and the principles of teaching as folks in education do. And so that will come into play as I talk about course development a little bit. I have taught didactic, I have taught clinical, I have taught from undergraduates through doctoral students. And building up to my role, I taught in both our child and adolescent psychiatric nurse practitioner program as well as in our adult, which used to be two distinct programs. My first experience with teaching online was based on a HRSA grant we got because we realized that if we needed providers in child and adolescent mental health other than in the area of Rochester, we needed to reach out to them. So we really purposefully designed that in order to get students and providers in rural areas. Those were my dissertation days, however, and I don't know if anyone is experiencing or remembers dissertation days. I was not quite able to capture on all of the learning about how to do this well at that time as I have now at 2011 was the end of my dissertation days. And we moved to our two distinct programs into one lifespan program. So if you can imagine, I'll talk a little bit about it, taking a course that, curriculum that was developed as an online curriculum, at least hybrid online, and one that was a face-to-face curriculum, and sort of melding those together is kind of how I came into this. And just recently, in the last several weeks, we got approval from New York State to make our program a fully online program, which essentially means that it's much of what we're doing already, but we'll have even fewer face-to-face opportunities to meet with our students in that way. Okay, so what am I talking about? So my courses, I oversee the program, of course. I have a co-director who does that with me. But I work in psychiatric assessment and diagnosis, in psychotherapy, in theoretical frameworks. And of the three of those, I'm guessing you could figure out which one might be easier to teach in a fully online format. Any guesses? Theoretical frameworks. That one was sort of easy to think about and to pull off. You know, it's more didactic, case-based application. The other two are both didactic and clinical, skills building. And if you think about psychotherapy in particular, or assessing somebody in a clinical arena, harder to wrap our heads around doing that in an online format. And additionally, we have very diverse students. We have students that come to us after years of experience. We have students that come to us straight in an accelerated program into nursing, so they've never even been a nurse before, and now they're trying to be a nurse practitioner. And we have students that come who have been practicing for years as an advanced practice nurse who need a postmaster's. So the challenges for getting content and getting a structure that's going to meet all the needs of the students when you're not looking at them each week in class to see how they're picking this up is challenging. And we need to have distinct content so people can come in, like for the postmaster certificate, and just get what they need. And so content delivery is a little bit easier. It's the skills delivery that has been a bit of a stretch for us. Making sense for folks so far? Okay. Okay, so this is the lessons learned, and I'll have you know that Eric graciously made us a template for our slides where what will people want to know. And these are written a little bit generically, but if there's specific questions, particularly as you get through the speakers, you know, I'm happy to answer those. So trusting and utilizing your experts. Yeah. So in this room alone, I can look across and see several people who are the wind beneath my wings, so to speak. Not coming from really an education background, really having to look to the folks who know how to do this and do this well and are patient in helping you do that. Starting with objectives and aligned teaching strategy, student activities, and assessment. Teaching for dummies, right? Like this is the folks that many of you in this room know already. But when you're doing it in an online format, the intentionality, the purposefulness of that is really something that you have to stop and pause. I can't catch up when I get them in class and kind of see the questions on their faces or raise the things that I want to raise. I have to think about how am I designing that in an online format that's going to touch all of those things so that I can be assessing along the way. Giving time, this took time. The folks from the School of Nursing, Andrew and Joe, can attest that we've been talking about redesigning one of my courses, the one that I've been teaching this fall, the Assessment and Diagnosis course, for a while. I knew it was coming, I just couldn't get my head around it. And then working on it this summer was really helpful. Trial and error, not everything's going to work right the first time. And for me, I had to learn what are the technologies, what are the resources, how do I do this, and really get a lot of feedback around that, not from my experts, from my colleagues, from my students. I just met with them for their last Zoom class or synchronous class yesterday and kind of got their input on how it went. And really kind of getting excited about it because there's a lot of opportunities. There's a lot of new technologies. It's cool stuff that we can try. So those are the kinds of things that, you know, when you get bogged down, then there's something that's like, oh, well, that could work this way. Okay, so teaching. This is, again, things that you might hear again from the folks that are talking after me, but this learning community. So how do we approximate this in-class experience? I like to think a good in-class teacher. I get excited, I'm dynamic, I can read a room, my students can interact off each other, I can facilitate that, and how do I get close to that online? So the strategies for having people have opportunities for engagement with each other, using discussion boards, using a variety of platforms, using, like I said, the Zoom, which is a synchronous technology, really helpful to sort of doing that and kind of setting the tone that we're all in this together. That idea of faculty presence, so that takes time and attention. You need to be purposeful. I've learned in terms of making sure that I'm, you know, communicating with my students, at least all of them, at least weekly, and then individually as needed. Having the places in the discussion board where I'm cutting and using this various technology, using a voice thread, for example, where people can hear you talk versus a discussion board where it's a little bit more static. So these are things that my colleagues have helped me with it as well. And really being flexible, so back to that previous slide about designing the course, thinking about how this is going to work, how it's not working, what do you need to change. And we still have challenges, particularly in my area of expertise, really thinking about therapy. We haven't conquered yet how to teach people how to do therapy well online. There are things that we've done. I ran a virtual lab with my students for assessment and diagnosis where we used Zoom and we did a video and I could break it down with them and we could talk about it and people, you know, what are you seeing here? What do you like? What you didn't like? What are the symptoms? What does it make you think diagnostically? Then I could break them out into rooms and they could try it with each other. That was good strategy. It was like, yeah, okay, we're getting closer, but there's things that we aren't quite sure about yet. Also, there's some pushback in terms of my discipline is based on interpersonal relationship and connection, and in a society where we tend to are distancing ourselves more and more, is there value in sort of, you know, colluding with that? What do we need to do? How do I need to see a student in a room? So those are the things that we're trying to balance. So what do I want to share with you? For me, it was not easy. All right, this was a leap of faith. Can I teach how I've always been teaching in a new modality and still have the same outcomes? I didn't know. I think so. I think it's been worthwhile. My students like it. My students, I can reach them. I have students in Michigan and way in North New York and New York City, and I have a reach. I am in a profession where we need more providers. So this is a modality to do that. It's pretty cool. I think the potential is really limitless. I think part of it is I'm limited by what I know. What I don't know, there's a lot more I don't know. There's a lot of bells and whistles out there. There's a lot of different things. I think that I'm a new student to this, and there's a lot of places that we can go to get better. But also the audience. So I mostly work with younger professionals, some of them older like me, but they're very used to being technologically driven. They are sort of about it, but my colleagues, my faculty colleagues, not all of them are on board. And I have a program that sits within a larger context. So we have students that are in classes that are not taught by my specialty faculty. So to get the folks in what we call the core professional classes sort of on board, it's a little bit harder. I'm having to think about doing psychiatric assessment diagnosis. I have colleagues trying to think about health assessment. How do you teach someone to do a physical exam on somebody online? How do you measure that? How do you know they're doing the right thing? So these are the stretches, and to be aware of them. Knowing your resources. That's big. That's where I look around the room again, and whether they like it or not, these are my lifelong friends. Well, I will be sending holiday cards to you all, because they've really put up with a lot from trying to sort of impart their wisdom and sort of growing together. And then I think it's fun. I think it really can be fun. It really can be exciting. It's really a new way to think about engaging with people, and it's sort of timely. This is where we are as a society. So with the ups and downs, it really can be something that you can enjoy.